Good afternoon, everyone. We'll get started. On today's briefing, we'll hear from Milwaukee County Executive David Crowley, Mayor Tom Barrett, Dr. Ben Weston, Director of Medical Services for the Office of Emergency Management, and Adam Von Spangeren, covering Wisconsin Health Insurance Navigator Program Manager. Thank you all for being here. And County Executive, I'll hand it over to you.
Thank you, Catherine, and good afternoon, everyone, and thank you for joining us. I just want to kind of reiterate a few points I shared yesterday during my vision speech as it relates to health disparities in Milwaukee County, but also the challenges that we're currently facing because of COVID-19. As you all are aware, Milwaukee County is ranked 71 out of 72 counties for health in the state of Wisconsin. And we know that the differences in health outcomes are a direct result of a set of health determinants like income level and educational attainment. And we do know that the pandemic has only exacerbated these issues. We know that 60% of the total confirmed deaths since the start of the pandemic have been African Americans. I mean, they also make up about a third of the confirmed COVID cases here in Milwaukee County. And because we've had to make dramatic steps in order to stop the spread, we've seen our economy contracted. We've seen businesses have to adapt or shut down during this pandemic, or we've seen how people have had to change their work environment in some type of capacity, reduced hours, working from home. And many people have actually, who are actually exposing themselves even more through their job, and those who have actually lost their job entirely. The dramatic disparities have highlighted by this pandemic show the deep inequities that have existed. And these disparities exist not just because of these disparities don't just affect those with historic lineage to slavery, it affects all people of color. And while COVID-19 may be new to us, again, the disparate racial impact of this virus has been deeply rooted in historic and ongoing social and economic injustices. The persistent racial disparities in health status, wealth, employment, housing, poverty, to name a few, all contribute to the greater vulnerability to the virus economically and physically. And so we understand that, and we must understand that we are one county stronger together, and together we have the power to make the change. And we're shifting our focus upstream on strategies that prevent poor outcomes for everyone in Milwaukee County. And I believe that we're well positioned to achieve this bold vision. And we're addressing our own policies and practices upstream so we can improve those services for everyone who needs them. And so if you want to hear more about what we're doing in our strategic focus areas, please visit my YouTube channel or visit our Milwaukee County website for more details. Today is also voting day, and I know the mayor may touch on this a little bit more, but I want to make sure that everybody gets out to vote, as well as making sure that you fill out the census form as well. And with that, I'd like to hand it over to the mayor.
Thank you, Mr. County Executive, and thank you for your work on racial equity. I think that you're obviously doing what's really, really important to the residents of our community right now. What I want to talk about for a little while is the issue of reopening our schools. We've gone through a lot of work here in the city of Milwaukee, and I will be giving a lot of credit to our health department as I do this, as to how we carefully and correctly reopen our different institutions. So even before Milwaukee had its first case 5 months ago, we knew we needed to set the stage for a thoughtful and science-based guidance for keeping Milwaukee safe. And among the most important people that we needed to protect clearly are our children. So the reopening of schools during the COVID-19 pandemic is a complex process, as there must be many considerations, not only for safety, but additional circumstances involving economic hardships, social isolation, and nutritional and developmental wellness. Education, as we all know, is a vital component to communities and impacts our overall health and well-being. It's also important to acknowledge the importance the schools themselves play as they serve as a resource for public health interventions by addressing core needs such as nutrition, access to health, social support services, engagement, and support of families and the community as a whole. The team of people inside and outside of city government has delivered the guidance that schools will need to move forward. That guidance will be released later today by the Milwaukee Health Department. I want to thank all the people who've been involved in helping us reach this consensus. Obviously, the Milwaukee Public Schools were able to reach a decision several weeks ago. Our health department has been working very, very closely with other schools throughout the area to make sure that as they seek to reopen, they're doing so in a thoughtful and safe way. So there will be three different components that will be required. One is to have a plan for a full virtual, one is a hybrid, and one is in person. And what we are asking the schools to do, and what is expected of them, is to submit their plans to the Milwaukee Health Department for their review. And they will review these plans. And again, these will all be released later today so that people will have an opportunity to see exactly what to do. But I want to make a point that goes beyond that, because as we now are in our 5th month of this crisis, this pandemic in our country, we have seen essentially a failure at the federal level to really act. At the state level, we've seen a paralysis, and the paralysis has been caused in large part because of the refusal of the legislature to become engaged in this issue in any fashion, in any responsible fashion whatsoever. What does that mean? That means that all of this has been left to our local health departments. And here in the city of Milwaukee, where we have had a disproportionate number of deaths among our African Americans, where we've had a high incidence of COVID-19 positivity findings for our Latino population, we know that those individuals that are most susceptible to this and who have historically been the most hurt economically are the ones that are most at risk. And so we as a city have worked, and I say specifically our health department has worked incredibly long hours to try to do what is necessary to help nearly 600,000 people here in the city of Milwaukee. And so I want to give them a lot of credit because they have worked overtime, and I mean weekends, I mean nights, to make sure that we have a thoughtful reopening of our churches, that we've had a thoughtful reopening of our bars and restaurants, that we've had a thoughtful reopening of our retail establishments, our daycares, our preschools, hair salons and barbershops, our athletic clubs, our gymnasiums, gatherings, whether they're funerals or weddings. Our health department, our local health department, has been asked and required to do work that you would think would be done at the federal level or at the state level. But because of the absence of any meaningful and positive guidance from those levels of government, our health department has been the ones that have been forced to really come up with this. This is something new for our health department. We have never operated in a pandemic before. And so now here we are, basically in mid-August, being required to come up with plans for the reopening of schools. And we're happy to do it. We know that that's our obligation, but you put that along with the work that we've done with the universities, with the preschools, with the daycares, with all the churches and bars and restaurants, and you can see that this is a tremendous burden that's being placed on our local health departments. So I want to acknowledge all the people who work in our health department, from Commissioner Kowalik on down, who have put in long, long hours. It's important that everyone sees his or her role in getting us back to a more normal life. It's important for our health, our economy, and our children. And a lot of people are working very hard to protect our residents in this very, very significant and dangerous time. So with that, I'm going to turn it over to Dr. Weston, who's done a tremendous amount of work as well. Dr. Weston.
Thank you, Mr. Mayor. I appreciate that. Good afternoon. First, as always, to our numbers, we have 20,284 cases of COVID-19 in our community and 394 individuals who've died. Overall, we're seeing promising trends in our county. We're having a downtrend in cases and hospitalizations, and an apparent downtrend, or at least a stability, in our positivity rates. On the more concerning side, we are seeing a downtrend in individuals choosing to seek out testing throughout the county. And this is particularly in the more southern municipalities in the county. So for no matter where you live, if you have symptoms of COVID or if you have concern for COVID-19, it's essential that you get tested and know your status so that you can avoid transmitting the disease to others. Today, there's a few questions that came from community members that I thought would be worth taking a few minutes to address. I think there are common questions that I've heard from a lot of folks over the last weeks and months. So first, a question about masks. A woman from Shorewood asked, when I wear a cloth mask all day long, I get worried about breathing bad air. Is it really safe to do this? I hear this question come up a lot. There's different varieties, sometimes concerns for bad air, sometimes concerns for lack of oxygen or breathing in too much carbon dioxide with a mask. To be clear, this should not be a concern. There's a myth that you don't get enough oxygen breathing through a cloth mask. It's just that, it's a myth. Oxygen and carbon dioxide exchange easily through a cloth mask. Next, on a related note, a woman from the city of Milwaukee asked, when gathering with a small group outside, is it really necessary to distance or to wear a mask? So we know that being outdoors is safer than being indoors. The open air is always circulating, and really any level of breeze helps to dissipate the aerosolized virus and the droplet particles. That said, when physically close to someone, you'll still inevitably inhale the air that they're breathing out. That's why physical distancing is still important, and wearing a mask when not able to appropriately physical distance is still critical, even outside. So I've seen many gatherings in open areas where everyone sits in a circle, they're spaced apart to visit with each other. This is a great way to physically distance without having to socially distance. Third, a young man in Brookfield, a bit outside of our county, asked if it's likely, he said, is it likely that I can contract COVID while at the gym, even if everybody there was wearing a mask? So with gyms, unfortunately, the combination of an indoor space, heavy breathing, and often closely spaced equipment can make gyms environments where transmission can certainly occur. Now that said, if everyone's wearing a mask, if the equipment and the people are spaced out by a minimum of 6 feet, if there's reasonable airflow and there's good cleaning practices in place, the risk of transmission can at least be minimized, though it is still certainly present. But masks and physical distancing are essential. And the last question for today, a woman from Wauwatosa asked, should I still be limiting the number of times that I go to the grocery store like I did in the beginning of the pandemic? So we know that COVID-19 is widespread in our community, no matter where in the county you live. And for that reason, we want to continue to minimize being in crowded environments. Grocery stores throughout the county have done a great job of adapting to this new normal and encouraging physical distancing, mask wearing, and good cleaning practices. That said, it's still important to minimize your exposure to places with lots of people, including the grocery store. So while the old grocery store, the daily trip to run and pick up a few items is not ideal anymore, weekly stocking up is certainly reasonable, especially if you follow the state and some local orders and wear a mask and physically distance as much as possible. So in summary, the ongoing theme here is that what we've talked about before: people, space, and time. Minimize those you interact closely with outside of the home, expand the space in which you interact and wear a mask, and minimize the time that you're interacting closely. We all know that we must make changes to our everyday behavior to best promote the health of our community. County Executive Crowley yesterday at his vision address outlined the county's updated values of influence, integrity, and inclusion. We can work to influence those around us as role models in community wellness. We can demonstrate integrity through responsible health behaviors, and we can be inclusive by reaching out to those around us and those facing struggles in these challenging times. Thank you very much, and stay safe.
Thank you, Dr. Weston. And now we'll hear from Adam Von Spankeren with Covering Wisconsin. Adam, I know you were having a few technical difficulties. Are you able to join us?
Yeah, I can certainly speak. I was looking at the video settings. This has never happened with Zoom before. Usually it just starts right up. I'm not sure if there was something different about the format today. I'm happy to just speak, but I don't want to be super distracted trying to figure out the video, although I would certainly be more than happy to be on camera.
Yeah, well, for now, why don't you go ahead and share your resources, and if you can figure it out, then we can adjust. But go ahead and talk about the Covering Wisconsin resources. That would be great. Yeah, no, that sounds good. So for people who don't know, and that's a lot of people, so we really want to spread the word. Covering Wisconsin is the state's navigator organization. And what that means is we help connect people to health insurance resources, health insurance for free. We're trusted, we're federally and state certified to help people for free access, whether it's Medicaid or federal marketplace, or help them figure out their employer-sponsored coverage. We do all of that for free. And before the pandemic hit, there were about 67,000 people in and around Milwaukee without insurance. And now with it rolling forward, we know that many more people have been affected. We don't even have all the numbers yet because of the different situations with layoffs and furloughs and people losing access to health insurance. But a pandemic is no time to not have health insurance. And while
people are struggling with the different priorities they have to address food, housing, making sure that all ends are met to whatever extent they can be. Health insurance shouldn't be forgotten, because it's critical that people are able to stay well during this time and have the protections and the confidence they need if they do contract COVID-19, heaven forbid. The resources are there. So a lot of people who might be losing insurance right now might be offered COBRA, and that's it is an acronym, and I do know what it stands for, but I don't think it's useful to explain that to people, because we have so many acronyms, and health insurance is so inherently complex and confusing that it is very easy for people to get overwhelmed. And that's why navigators exist. That's why Covering Wisconsin exists. So if you're offered health insurance through COBRA, when you lose your insurance through your job, you may be tempted to take it, but the thing about that is you're basically looking at health insurance for full price. So whatever fraction you were paying before, you would now be paying the whole thing, which, when you've just lost your primary source of income, doesn't really make sense. So it's important people know that they have other options. So they have Badger Care through the state. That's the state's Medicaid program. If your income is low enough, you can get on Badger Care, which is essentially free health insurance from the state. Their other options are through the health insurance marketplace, which is Obamacare, the Affordable Care Act. It's the marketplace set up that has private health insurance plans and savings that can reduce someone's monthly cost to less than $100, sometimes even zero, depending on someone's situation. But people don't know if they don't look, if they don't have the confidence of actually exploring those options. That it's, again, very easy to get overwhelmed when you're thinking about and looking at insurance. And that's why Covering Wisconsin exists. So we have experts. We've been doing this for years. We are well versed in all of these policies and health insurance. We can answer all of your questions, and we're here to help. And that's the main thing I want people to take away, is that you have options. You shouldn't do nothing. You should, even if you're not sure what you might be eligible for, you should certainly be thinking about it and at least make the call to Covering Wisconsin. I know the number was put into the chat, but our Milwaukee office is 414-400-9489. That's 414-400-9489. And also the number to remember, a good number to remember, is 211. I know it's been promoted before, and it certainly helps people, whether they're trying to connect to us or trying to connect to one of their testing sites. The National Guard has testing sites, and you can always call your doctor if you are insured, or look at some of the free clinics or the qualified health centers in town, which include Milwaukee Health Services, Outreach, Progressive, Gerald Ignace, 16th Street, and I think that's all five. Milwaukee Community Health Center as well. So there are resources around town, but it's important to remember the big picture as well. And I think County Executive Crowley really set this up, and the mayor carried it forward. But the racial disparities, they extend to every aspect of the system of life, whether it's looking at somebody's health or their financial situation, their longevity, their susceptibility to COVID-19. And it's health insurance is a piece of that. And Covering Wisconsin works to help promote racial equity by helping people answer those questions, by figuring out health insurance, because health insurance is the gateway to healthcare. So you're not going to have good health outcomes unless you're able to navigate the system, and that's what we're here for. So we really want everybody who needs any help with health insurance to call us. We're free, we're here to help, and we won't steer you wrong. Thank you.
Thank you, Adam. We appreciate you joining us today to share those resources. That concludes the first portion of our briefing. So now we'll move to media Q&A. And our first question is from Anissa Johnson with Milwaukee Journal-Sentinel. I know we don't have Commissioner Kowalik on the briefing today. Mayor Barrett, you might have some updates regarding these questions. She asks, will the health department begin tracking COVID cases by schools?
Well, under the plan that will be released later today, if there is a positivity finding among a student, that has to be reported to the health department. And if there are two positivities, that then would require the health department to come in, and then there'd be a choice as to what the school would want to do. It could either take steps to, in essence, go virtual for a period of time, or it could test all the students. After that, there'd be another stage. So the identity of the students is not to be released, but yes, they are required to notify the health department if a student or a teacher, for that matter, a staff member, tests positive. But I'm going to allow the health department to go more into detail about that, but that is part of the plan.
Excellent. And the follow-up portion of her question is probably for the health department as well, but you might be able to shed some light. She asks, can you give us an update on how many K-12 schools and or universities have submitted reopening plans to date?
I don't know that number off the top of my head. Again, I think that the health department can certainly get you that information. We're happy to share that information with you.
All right. Her colleague Allison Durr with Milwaukee Journal-Sentinel has a few follow-up questions, one also related to schools. She asks, Mayor Barrett, how soon do you anticipate schools' reopening plans being approved, and what will the deadline be for schools to file their plans with the health department?
Well, I will tell you that, again, the health department has been working very, very long hours on this. They've been working with the Milwaukee Public Schools. They've been working with some private schools, and they understand, and I understand, that a number of schools want to have a mid-August start. And so I anticipate that if they get all the information in, that it's not going to be a lengthy turnaround period. But later today, again, you'll get the guidance as to exactly what has to be submitted. I think there are going to be several documents that need to be submitted. And once that's in, the health department can start reviewing those. And I think some schools, in fact, I know some schools, certainly some universities, have already submitted their plans, have had their plans approved. Now we're essentially in the K-12 arena. And I anticipate that a lot of those are going to be submitting their plans in days, if not hours.
Excellent. I'm going to jump to Tom Durian with TMJ4's question because it does relate to schools as well. He's just asking for a clarifying point from your earlier comment, Mayor Barrett. He says, are schools in both the city and county required to have plans? And will the health department release this information today?
This is a city plan, so it covers the city of Milwaukee, not the suburban areas. And again, the health department will release these, both of the documents that I've referred to. They will be releasing those later this afternoon.
Perfect. The second question of Allison Durr's question was, has the city seen any voters resisting wearing masks or taking other COVID-19 precautions at the poll today?
Usually if there's something bad that happens, I'm contacted. I have not been contacted about any resistance. I have seen a couple of emails of people who have complimented the Election Commission and the Health Department and the way the city has handled this. So I like getting those. Feel free to send those in if you're happy. But people have been pleased because we're taking a lot of precautions. And as I've said before, this is really a marriage between the Election Commission and the Health Department with all the precautions that they're taking. And I think people will be pleased if they come to vote in person as to how safe it is. And that's obviously our goal.
All right. The next question is from Derek Rose, and he's asking for Dr. Weston, or if others want to comment. Given the Big Ten just announced it is canceling the fall football season, is there any guidance in the information expected today related specifically to interscholastic sports? And then just in general, what should schools also be considering canceling fall sports?
So if I followed the question right, it's colleges are canceling sports. Should our local schools be canceling sports is kind of the short of it. So I think it's certainly a school by school decision. I think they should work closely with their health departments. There are some, like we talked about before with gyms and with outdoors and things like that, there are some benefits to sports that make transmission less likely. A lot of times they're played outdoors. A lot of times, depending on the sport, they can be played from more of a distance. So I think it's hard to have an all-encompassing answer Should kids play sports? Should they not? There's also, just like going to school, there's the risk benefit of children get a lot of social activity with sports. They get physical activity with sports. They get the sense of teamwork and camaraderie. So there's a lot of benefits on top of the risk. So I think it has to be an individual decision that health departments are making in conjunction with schools, in conjunction with parents, and understanding the specifics of the sport.
Thank you. Anything to add, Mayor Barrett, as far as information being released?
Actually, I do have more information. I'm happy to report that the plans are now online, so you can look at them at city.milwaukee.gov/MMFS. So for all of your viewers who are interested in seeing what those plans are for schools, again, they're now online at city.milwaukee.gov/MMFS. That's hot off the press.
That was good timing. Thank you. And Sean Benjamin also shared that in the chat for all of those to reference the URL. So thank you. And the final question that I'm seeing in the chat is from Chuck Kornbach with WUWM, and it's for Dr. Weston. He says, the state has now topped 1,000 deaths. What demographics stand out to you?
Yeah, so it's an unfortunate landmark to have approached. I think the demographics that stand out most to me, we've certainly seen age ranges, and this is no surprise. We know that our older age groups are more susceptible to COVID-19, are more likely to die of COVID-19, but we also know that young people are as well. In Milwaukee County, we've had 6 individuals in their 20s who've died, and statewide they've had many more than that. I think the other statistics that really stand out to me when we, as a county, as a city, as municipalities, think through a racial equity lens, we know that statewide, an African-American person is nearly 4 times as likely to die of COVID as a white person. And we know that a Hispanic person is just about 2 times as likely to die. So I think those are concerning statistics. I think they go along with the county executive's discussion and his vision address yesterday, and what we as a county need to focus on moving forward.
Thank you, Dr. Weston. At this point, those are all the questions I'm seeing in our chat. So thank you all for joining us today. Thank you for sharing all of the resources. Adam, it's good to see your face.
Yeah, finally got it working a little late.
That's all right. We appreciate you joining us today. Thank you all. And that concludes our briefing for today.
Great,
Thank you,
thanks.
Catherine.
Thank you.
Thanks, everyone.